The name ventricular ejection tells us that this is the phase that ventricles eject blood, pump blood out into the arteries. And ventricles can do that by contracting their myocardium. So right after isovolumetric contraction, in the video about isovolumetric contraction, I explained this is the phase that ventricular walls contract, and to prevent backflow of blood from ventricles into the atria, AV valves quickly close. So this is the phase that AV valves close. Semilunar valves are not open yet. All four valves are closed. The volume of blood inside the ventricles does not change. That's why we name it isovolumetric, and we emphasize that ventricles are contracting. Exactly after this phase, the contraction of ventricles become obviously more forceful, applies pressure, and open semilunar valves. So as you see in the image, both pulmonary semilunar valve and aortic semilunar valve are open, and contraction of the ventricles obviously would be the source to create the pressure to push blood out into the arteries. From right ventricle, blood is pushed into pulmonary trunk, and from left ventricle, blood is pushed simultaneously into ascending aorta. So that's exactly what we mean, that during ventricular ejection, ventricles eject blood into the arteries. So as a summary, we know that atrial walls are relaxed during ventricular ejection, because as I mentioned in the videos, atrial walls contract only during atrial systole. During all other phases of cardiac cycle, atrial walls are relaxed. So during ventricular ejection, atrial walls are relaxed. The ones that are contracting would be ventricular walls. And we say ventricular ejection, so the exit out of the ventricles, semilunar valves, are open, and ventricles literally pump blood out. And when ventricles are pumping blood out, that's not the time that they can receive blood. So the entrance into the ventricles, AV valves, are closed.